Craig, sorry.
Thank you so much, Kirsty. So now on to our fourth and final research talk, entitled How Does Attendance at Schwartz Rounds Impact Veterinary Professionals' Experience in Clinical Practice? And I'd like to introduce you to Emma. Emma graduated from the University of Glasgow and worked in small animal primary care practice prior to joining the University of Liverpool, where she completed her PhD. Emma is currently head of veterinary education at the University of Liverpool, where she combines teaching veterinary professional and clinical skills with pedagogic research centering around student progression and remediation, development of reflective capability, and well-being and inclusion within the veterinary profession.
Thank you very much. So I'm here today to present on behalf of Rob Campbell, who can't be here. He undertook this research and I had the joy of being his supervisor. And when I say joy, I genuinely mean a joy, because his enthusiasm for this project was infectious, and his belief in Schwartz Round is what's really enabled them to be a success at the University of Liverpool School of Veterinary Science. So before we start thinking about the project itself, I just want to review what Schwartz Rounds are. On the right-hand side of the screen, you'll be able to see a picture of Ken Schwartz with his family. He was a US healthcare lawyer who was diagnosed with lung cancer in 1994. And in the 10 months before his death, he recognized the importance of the patient and clinician relationship and the importance that caregivers had in enabling a positive experience for patients. He published with it an article in the Boston Globe which highlighted that it's the smallest acts of kindness that can make a real difference and make the unbearable bearable for patients. So his legacy was to set up the Schwartz Rounds. They're a forum where all staff can discuss the emotional and social aspects of working in healthcare, social care, and now veterinary care as well. Currently, Schwartz Rounds are licensed in the UK by the Point of Care Foundation. You may have seen an announcement at the end of last week that the Point of Care Foundation is closing at the end of this year. So thank you for the organisers of the conference for sending my slides back to me and allowing me to amend a few things, because there is still the possibility to run Schwartz Rounds in the UK. It's just going to be supported by another organisation. So Schwartz Rounds have been well established in the NHS since 2009, but they are relatively new to the veterinary profession. They were first adopted in a veterinary practice in 2016 by Holly House Vets in Leeds, and in 2019 the RCVS ran a pilot involving 7 sites setting up Schwartz Rounds, and the University of Liverpool was one of those sites. So the format of a Schwartz Round is very, very important. It's important that attendance is voluntary. Nobody is forced to attend a Schwartz Round. It's also important that it is included within the day-to-day of the workplace. It shouldn't be an add-on that people have to stay for, give up their lunch for, or give up their free time for. The Schwartz Round is not there to find clinical solutions or expertise from someone about a case. It's not there to problem solve. It's to reflect on the emotional experience of delivering care. The rounds are centred each time around a chosen theme. In some cases, that might be a specific case where different members of the team have experienced with that case and discussed their experience. But it may be a more broad theme, such as a case I'll never forget or in at the deep end. The Schwartz Round follows an evidence-based format. Firstly, there are facilitators who have been trained to facilitate the Schwartz Round. They will introduce the background of Schwartz Rounds and also how the Schwartz Round will progress. And then they'll pass over to the storytellers that they've met before the round, who they've helped to curate their stories. The storytellers speak uninterrupted for 5 minutes each, and after that, the facilitators will welcome discussion from the audience. It's worth noting that because reflection is a part of Schwartz Round, we expect there to be silence. That is to give people time to reflect themselves before they wish to add anything to the discussion. So the facilitators are not there to add their own contributions to try and get the chat going. They're there to welcome the silence and then allow the discussions to start when people are ready. The importance of the training is that the facilitators are providing a psychologically safe space for participants and to provide emotional containment within the rounds. Once the discussion has finished, facilitators will close the discussion and pass back to the storytellers for any final closing statements that they wish to make. A Schwartz round will last for 1 hour, and it's very strict that they last only for 1 hour, hence why you should be able, hopefully, if you want to do it, to find space within the working day for them to take place. Participants are encouraged to discuss their experience of Schwartz rounds outside of the round, but any specifics that have been discussed within the Schwartz round should remain confidential. So what evidence do we have for the use of Schwartz rounds so far? There is a strong body of evidence within human healthcare settings and within human healthcare higher education institutions. Within the veterinary sector, however, we have one study that was taken by Amy, who sat just over there. So if you want to discuss her study with her, you can discuss that later. The key points from her study were looking at a retrospective review of Schwartz rounds for a veterinary team. The key points from this were over 90% of attendees found the group discussion helpful. Of the 18 Schwartz rounds that were held, about 30% of the practice team attended on average. However, the highest attended round had a 50% attendance, and that was entitled Why I Come to Work. So it shows you that having different themes can engage different members of a team. This was the first study supporting Schwartz rounds as a reflective space for vet colleagues and highlighted the need for qualitative data to further understand the impact of Schwartz rounds, which is where Rob came in. So for his study, he asked 2 research questions. The first, in what ways did attendance at Schwartz rounds impact the experience of veterinary professionals who are working in clinical practice? And secondly, are the proven benefits of Schwartz rounds in human healthcare translatable to those working in the veterinary profession? To advertise the study, Rob utilised the Point of Care Foundation, who circulated the poster you can see, as did the University of Liverpool Veterinary Alumni Association and the University of Liverpool Central Alumni Team. Participants were invited to contact Rob and take part in semi-structured interviews, and he had 10 participants who took part. All the participants were required to have attended at least 2 Schwartz rounds whilst working in clinical practice, and the transcripts of these semi-structured interviews were processed via reflective thematic analysis. Data saturation was achieved after the 10th interview, so no more interviews were undertaken after this. And from the interviews, 8 sub-themes were identified with a final 3 themes generated. So in terms of the participants, as I've said already, there were 10 participants. 6 of these were vets and 4 were vet nurses. 9 of the 10 were female, there was 1 male participant. 3 worked in equine practice, with the remainder working in smallies or exotics practice. And there was a range of experience between 5 to 25 years in clinical practice. The reflective thematic analysis process has been described previously by other presenters today, but just to highlight the process. After each interview, there was data familiarization, and Rob would take clear notes highlighting any interaction he had with the data to identify if there were any biases or assumptions that were made during that process. Once he was familiar with the data, he then summarized it to then find some core themes. So there were these 8 core themes that we considered sub-themes, and then the sub-themes were arranged around core commonalities, and we got 3 of these. So to give an example, we have a transcript extract here. I don't think I expected the feeling to be so profound, actually. The feeling of processing, letting go of something that I've been carrying. And as we know, most of these stories, people have been carrying for years and years and years. And yeah, it felt really profound. So that was summarized to the process of being a storyteller during a Schwartz round is cathartic. and the act of proclaiming the story is emotionally purging and healing, and that fed into a sub-theme of the impact on the veterinary professional and an overarching theme of enabling compassion. So as I said, there are three main themes. The first one was the ability to enable compassion. It was recognized that hearing other people's stories allowed self-compassion, compassion with colleagues, and more widely, overarching, outside of the round, there was client compassion as well. It was noted by participants that being able to share and having people sharing back allowed them to see that people resonated with their experience, that their experience was valid, and that allowed that self-compassion. It also allowed to see other people's perspectives and the skills that they gained whilst being in Schwartz Rounds allowed them to improve listening to people out with the Schwartz Rounds. And in particular, people noted that they were listening better when people were experiencing emotional distress. So we know that the ripple effect was seen outside of the Schwartz Round space because it not only allowed additional compassion with people who were in the Schwartz Rounds, but with other colleagues and clients as well. The next theme was the ability to empower vulnerability. Being vulnerable and sharing takes courage. We know it takes courage for storytellers, but it also takes courage for members of the audience to hear someone else's experience and share their own experiences related to that. So the Schwartz Round created a psychologically safe space for people's professional masks to lift and them to be able to feel vulnerable. It was particularly highlighted that where there could be seen as a power dynamic between those in leadership positions and those not, people really appreciated when leaders were vulnerable. Leaders appreciated the ability to show everybody that they were a person and they were also fallible. And those who weren't in leadership positions felt that by leaders sharing their own vulnerabilities, it was okay for them to be vulnerable too. People found it really meaningful when managers showcased their emotions. They felt it so sincere that they felt they could be more outgoing in terms of asking for support when they needed it, because that door had already been opened within Schwartz Rounds. Because people were showing more compassion to each other, they were able to reach out. And then outside the personal impacts, Schwartz Rounds also had the possibility of enhancing organizational insight. If we're remembering that Schwartz Rounds are always going to be voluntary, we know that there are core attendees of Schwartz Rounds. There are transient attendees who will come to some rounds and not others. And there are also people who will never attend Schwartz Rounds. Recognizing that there are these different populations enable people to see that people need different types of support. You can't just put one thing in place and expect that to suit everybody. It also highlighted that there are colleagues who never usually get the chance to connect, whether that be vets who are on consults only and don't get to mix with the surgical team, members of staff who are on reception all day and don't mix with backroom staff, people who have a desk-based role versus a clinical role. Because the entirety of the workplace is welcomed into Schwartz Rounds, it offers that chance for connection. It also highlighted, because these connections had been made, people had better understandings of each other's roles, the difference between clinical and non-clinical roles, and in some cases, this altered how members of staff were trained and how people were upskilled so that different members of the team could support each other appropriately. So in terms of the future for veterinary Schwartz Rounds, the first thing we really need to do is to build awareness. We need to introduce more veterinary teams to the concept, the reason why they're there, and that we have a growing evidence base. We do need to increasingly mention Schwartz Rounds within the veterinary literature so people can access them. In terms of supporting rounds, as I said, the Point of Care Foundation, following at the end of the year, won't be supporting Schwartz Rounds in the UK, but the Schwartz Centre for Compassionate Healthcare in Boston in the US will be. So there'll be a transitional period over a few months to get that support ongoing. So we want to make sure that people have easy access to support to foster this relationship between the support and vet practices. We need to ensure that if people want to undertake Schwartz Rounds, there's appropriate training is undertaken, the ongoing support is there, and people follow the clear framework so that Schwartz Rounds are a success. In terms of reflective practice initiatives, we know that many people are interested in starting Schwartz Rounds, but that needs to be supported from the top. You can't expect people to run these sorts of things as an added extra and expect them to just be a success because people are dedicated. People should be given dedicated time so that they can prepare for Schwartz Rounds and support the ongoing initiative. But it's important to note that also Schwartz Rounds aren't a panacea for veterinary mental health. You need other initiatives to ensure that we're supporting our teams. And finally, as we've said, currently there's one published study. We have submitted this study for publication, so fingers crossed soon there'll be two. We need to understand the reason for non-attendance, and also the barriers for those who want to engage but currently aren't. And also we need some longitudinal studies looking at, do Schwartz Rounds impact staff turnover, absenteeism from work, and do they positively impact patient care, and do they have an impact on clients, and can we evidence that by levels of complaints that are seen? So for anybody who wants more information about Schwartz Rounds, Rob and I are more than happy for you to get in touch with us, and if you want to set up rounds, the Schwartz Centre for Compassionate Healthcare has an email address at the bottom as well, and they'll be able to answer any questions you have about setting up the rounds. Thank you.
Thanks, Emma. That was really informative and useful. As someone who's been to Schwartz Rounds and been a storyteller at Schwartz Rounds, I completely agree with everything that you said about how great they are. I looked into it for our organisation with the Point of Care Foundation, and the training is about £9,000 for a 2-year licence. And so, not necessarily a question for you, but maybe for MMI, whether there's something that we could do around group training for lots of organisations. I don't know how that would work, but maybe that could be something that MMI could look to do in the way of sort of helping our profession, just because that cost might be prohibitive for a lot of places.
Yeah, definitely. I think as we took part in the pilot at Liverpool, we did get that support. So and that I suppose it is that institutional buy-in, isn't it? And I mean, we have lots of corporates in the UK as well, so maybe that, you know, that is an additional thing that we can look at as well.
Closely associated with that, actually, just thinking about potential barriers, one of the things which was often mentioned today was lack of time. And so I'd be interested to know whether you had I presume that the centres where the study was done, that was somehow negotiated. I was just wondering, did you come across any resistance, and how was the time issue dealt with, and could you see that as a potential additional difficulty?
So that time didn't come up. It didn't come up as a theme. I think one can only make assumptions as to why that didn't come up, whether it's that people are dedicated and therefore the fact that they're doing it out with their working hours, you know, in terms of preparing for it, is not something that, you know, they considered discussing, or it is that they are given that dedicated time. I think there's an importance in planning ahead. You know, in busy clinical centres, when you're thinking about when you're going to run rounds, you're probably going to have to block off time for that in the diary, for sure. So planning ahead is going to be really important, with the recognition that if emergencies come in, and emergencies come in. I know for us, in an academic institution, for us it is challenging balancing time when staff are available and students in 5 different years aren't doing something. So I think the main thing with that is the planning ahead, so that as many people can make themselves available if they want to be.
Thank you.
Thank you, Emma. So I'd ask you all to join me in thanking James, Angela, Kirsty and Emma for sharing their research findings with us this afternoon.